Hello everyone, and welcome to today's session. So, thank you so much, everyone who has joined our session. Welcome to today's podcast, where we delve deep into our healthcare system of Uganda. This is Dr. Hossain Al-Amin, a public health specialist, and I'll be your moderator for this session. And joining me today are the two esteemed guests, Dr. Mwaka Joseph, a student from Oxford University and a vaccinologist and a medical doctor, and Dr. Ibrahim Kirunda, a renowned health system strengthening specialist from Uganda. Together, we will explore the strengths, weaknesses, and opportunities within Uganda's healthcare system. First of all, I would like to give a very good thank you to my beloved guest, Dr. Joseph Mwaka. So thank you so much, Dr. Joseph, for joining with us.
Thank you very much for the invitation. I look forward to the conversation. Thank you.
Well, so Dr. Joseph, so what I would like to prefer to kick things off, let's start with an overview of the current status of Uganda healthcare system. So can Dr. Joseph, could you provide me some insights right now, what's going on in the Uganda healthcare systems and what the present status of the Uganda, so that people can know about your country?
Okay, thank you. Thank you, Dr. Hossain, for the introduction and the question seeking the general overview of Uganda healthcare system. Just to give an eye overview, Uganda is one of the countries that is making great progress in healthcare generally across the major pillars. From the human resource has been improving, though has been stagnating for the previous 2 years. And the healthcare infrastructures, the government has been trying to improve on the access, especially in rural areas. Financing has been stagnant. We have seen rise at some point towards the beginning of the previous decade, but due to COVID, we have had a reduction in the percentage of the national budget that is like contributed to health. And regarding supplies and all those, we have had quite improvement, but as I've said, we have had the shock of COVID and the prior positive improvement that we were seeing actually has been altered. If you are to see the demographic survey that is being done, you see that most of the health sector performances have declined a little bit. That is attributed to the general shock we saw related to COVID. But in a nutshell, I can say the country is moving towards the right direction. But I think there are broader systemic problems that is making the country to not realize its health sector priorities. One of the greatest challenge, which I can say, is the financing aspect, because the government contribution to health, I think, has been stagnating between about 5 to 7%, and the greatest share has been coming from the private donations and the private sector. So it is the landscape of healthcare in the country is more of dominated by donors and the private sectors. So it makes it more of a very, I can say, not very good for the common persons who may not be able to get services out of government settings in the cases where there are irregularities in the government setting, which is inevitable, like stock out of medicines, and sometimes the human resource capacity cannot be fully uh, 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 filled, and also the adaptation of technology is still very low. So all those factors, much as I started with a positive note, noting the striving uh, accomplishment that the country
Right,
has,
right. Dr.
yeah,
Joseph, thank you
there.
so much for your very good opinion regarding the present status of the Uganda healthcare system. And I'm really happy some people around the world have joined. So I really congratulate them. It most probably Mr. Akol, Soro David, Promise, Simon Oriokot, and Elizabeth has joined in our session. So after your convenience session, then we would like to move forward for the question answer session, and we wanted to know something about from them also their their feedback and how they can facing some challenges and what are the opportunities so that we can work together and get the better approach to establish the perfect healthcare system in Uganda. So my next questions to you, especially that what I am wondering that what are the notable strengths of Uganda's healthcare system that you have looking for, and how have they contributed to improvements in the public health outcome? Let's say what I wanted to say, you should have to say about the positive aspect of the Uganda's healthcare system. It may be the strengths in the preventive care, it may be the community health program, or the successful disease control measures. So, can you explain what are the notable strengths that you have, and so that we can work together and make it more strengthful, Dr. Joseph? You are in mute. Can you unmute yourself?
Sorry. Yeah,
Yeah.
I was saying the country has done well in quite a lot of areas. The notable one being the community of the country has been one of the good examples when it comes to implementation of uh, healthcare at the grassroots level using the community health structures. And it has been used as example of the good practice, which has been borrowed in many countries, of how to leverage the power of community structures uh, in the form of village health teams. They work closely with the primary level facilities, which are at as the hierarchy in most countries. We see that the healthcare is arranged from level 1 up to 5, and which is common among most of the low and middle income countries. That is the same structure. So at the grassroots level, there are village health teams, which actually act as the entry points and also connecting the community to the upper level of healthcare. So that has been one of the key strengths the country has seen since the beginning of this, I can say, century, the 21st century. It has been very good. Then another notable area has been in the HIV, TB, and malaria uh, programmings and responses. The country also has been used as uh, a benchmarker, for the lack of better words, for other countries within sub-Saharan Africa in responding to HIV and TB through the collaborative efforts of some donors, the water rates, the so many donors. They have worked well in ensuring the HIV implementations, drug trials, policies design have been tried in the country, and they have worked very well and have been benchmarked to a lot of other countries. So those two areas, I can say, they are very notable for Uganda. The other areas include participating in research generally. The capability of research in the country is ranked among the top countries in Africa when it comes to research. So those are the areas that I think the country has performed very well in them. And
Yeah. What I am understanding from your topic that you are basically focused on the community health, the community care system, as you are doing some successful health program with, in collaboration with government and NGOs, right? So definitely that is your strengths on the area. But parallelly, my next questions, according to that question. So what are the more significant weakness or challenges that you are facing on the healthcare system of Uganda, and how that impact your healthcare delivery? If I would like to say in a very easy way, so you just mentioning the critical issue that hinders the Uganda's healthcare system. It may be the inadequate infrastructures, it may be the limited access to the essential medication, or maybe the shortage of the healthcare professionals, or maybe the lack of the health innovation or using of the health technology or holistic approaches that is missing. So can you please elaborate what are the basic weakness that you wanted to face, and that challenges can be overcome and that may convert it into the strengths, Dr. Joseph?
Yeah, talking about healthcare systems of developing countries, uh, it is rather better to look at it in a very broader perspective, because the country faces a lot of challenges, but I will pick on only the low-hanging fruits, which I think can be turned into opportunities. Uh, one of the things which I think is facing the country is how to align the lower level services, the public health, with the curative healthcare services. I think there is a divide in there, because the country has not aligned what the priority should be. Should we invest more in curative, or should we invest more in public health? So when you are to look at the contributions of different maybe environmental health, genetics, and public health, and curative health services, you see that curative offer about only 10% to the total health stock. And there has been mismatch in the recent years, like due to the social media campaigns and all those. So you find that sometimes the government allocates a very large resource to maybe building a very big healthcare infrastructures, which actually do not serve. And in most cases, those interventions have not worked. There has been a lot of misappropriation of the limited resources of the government in trying to respond to the healthcare problems, but responding in a way that doesn't contribute to health to a broader sector. So I think in a nutshell, I'm trying to say that the programming of healthcare service in the country, we acknowledge that there is limited resources, but the way the limited resources have been put to use has been limiting. Knowing which area to invest in to give the biggest benefit has not been easy. And I believe that even with limited resources, money is not the only thing, because I've borrowed example of the US and the UK. The US spend the highest in healthcare, like they use a lot of money, but countries like some European countries spend less. But the countries that spend less, they know what to put money on. And that has been the problem of many developing countries, including Uganda. Where should we put our limited resources? Should we respond reactively to the media campaign talking about maybe someone maybe having poor outcome because of lacking a curative, rather than looking at the broader aspect of health? So I think if that one is addressed together with alignment of putting accountability for the resources, I think that is a low-hanging fruit. I have not dived into a broader systemic problem related to healthcare in the country.
Right.
Yeah.
Got it.
Yeah.
So I think another physicians have joined from Uganda, mostly Dr. Felix. Dr. Felix, can you hear me? Am I audible, Dr. Felix?
Oh, yes, yes, audible, very
So,
audible.
can you turn on your camera so that we can see you and we can get some of your opinion regarding the healthcare system of Uganda? Is it possible from your side?
Okay, yeah, sure.
Yeah, sure. Because we wanted to make sure that this is the situations, we wanted to collaborate and discuss together with our participants. So, Dr. Felix, can you introduce yourself in a very short so that I can ask some open questions to you also, and that will
Okay,
help us
so
and make us the program. Yeah.
thank you very much, Dr. Hossain, yeah,
Yeah.
and
Yeah.
Dr. Mwaka. My name is Dr. Felix. I'm in England. Actually, I'm based in Leeds. I'm doing my master's at the University of Leeds. And Dr. Mwaka is my colleague over there in Oxford.
Oh, wow. Right.
Yes, so my background is in refugee and humanitarian crisis programming for health services.
Right.
I've been in Uganda for the rest of the previous years back, working at the refugee crisis areas of South Sudan, Congo, and Uganda, northern part, before I came back this side in the United Kingdom for studies.
Wow. So
that's
this
a
is a very
brief
good background, Dr. Felix. Yeah. So I'm wondering to provide open questions to you as already Dr. Joseph has mentioned a lot of healthcare system agents or some things, about the Uganda healthcare system. So I have a
Yeah.
question. So could you elaborate? You have an experience to work on the humanitarian context and a lot of experience you have. So could you elaborate on the role of the government policies and the funding issues in shaping the current status of the Uganda's healthcare system? Let's say, the lot of the NGOs and are collaborating with government. So can you analyze this? So how policies are related to their healthcare financing, resource allocation, regulatory frameworks? So how you guys can deal it on your area, especially in the humanitarian context?
Well, those are very difficult questions, but maybe in a nutshell, you can say that Uganda has got good policies, but maybe they don't have the compassion to deliver them. Their objectives are different. The country's objectives are not necessarily to deliver proper healthcare for its citizens. They look like the country objectives are skewed to something else. And that's why they struggle to deliver quality, accessible, and affordable healthcare. They almost have everything we in terms of policy, in terms of guidelines that we need to and the direction, what we need in the healthcare. But you realize that they cannot implement it, they cannot realize it. One thing I have noted is that the country is mismatched. Our healthcare system, much as is well written in paper, is the human resources are mismatched. People are not in right positions. Be it the leaders, okay, they are not in right positions. We have wrong professions in the healthcare at leadership level. So you don't expect them to steward, to lead a proper system. Definitely, they will be leading the interest of the government, which
Right.
most times is different.
So
Compared to
I
other
think it's
countries.
very, very difficult to manage, because if there is not the right people in the right place, so there is there's a lot of problem to implement the work, right, Dr. Felix?
Yes, definitely. If you don't have the right minds in the right offices, you don't expect much. You just there as titular heads.
Exactly.
You can't make
So
scientific
yeah,
This is
So Dr. Felix, I would like to back to you again because we have some time shortage. We need to, engage a lot
yes,
all the people. So I just back to Mr. Soro David. Then I back to again Dr. Joseph.
yeah.
Soro David, can you please turn on your camera? So we got also Simon, Promise, Oyo, and Akon. We need to know about all messages from their side, how they can thinking about their healthcare system. So uh, David, can you please introduce of yourself and
Hello?
give your feedback? Yeah,
Hello?
we can hear you, David. Yeah,
Yes, I'm Dr. Soro David. I'm a
yeah,
Ugandan doctor currently
yeah.
practicing in rural southwestern Uganda. I would just like to add my voice on the healthcare system, mostly in the rural setting, because I did my internship in one of the regional referral in the remote southwestern region. The challenges I observed is for the donor-funded projects, HIV, TB, nutrition, our healthcare system seems to be doing very well because resources are always available, a lot of supports, community engagements, and projects fully supported, and the staffs are motivated. But when it comes to the sectors which Uganda government receives no funding, say for example, care, we only have one center of excellence for cancer care, and from my regional referral to the Uganda Cancer Institute, which is where most of the treatment were received from, it's over 500 kilometers. So most patients are diagnosed late. And when you tell a patient you need to go to Uganda Cancer Care Center for treatment, it's almost like a death sentence. They rather go back to their communities. I think if a lot of effort is created in awareness, sensitization, and screening, most of these cases will be detected early. That's just a case scenario. So most of the government-supported projects are poorly
Mhm,
executed and
mhm.
poorly funded.
Well, so
So
I have a parallel question to Dr. David to you. Have you using any kind of technological solutions, let's say EMR or app or something else, or you are using still now in the paper or pencil or paper or pen? You're using any automated system or you are using a normal paper and pen?
in the last 2 years, the government is trying to adopt EMR, but
Mm-hmm.
the implementation is still on pilot study. For example, at my hospital, it's not enrolled in the entire department. But for sectors like HIV and TB care, if they purely use EMR, all patients' records are stored and can be traced. But for the
Mm-hmm.
general patient care, it's only in the outpatient departments where they pilot. In the wards, we are still using paper-based solution.
Right, right. So thank you so much, Dr. David. It's a very good, Dr. Joseph, what you and me discussed. That's they are right now in the ground and they are providing their, the potential, you know, their feedback because it's very important to make some global policy making because what's their need and what's their feel in the ground. So that I wanted to connect these people so we can collaborate and work together. So I think another people I got, Mr. Simon Oriokot. Simon, can you please turn on your camera and introduce yourself and give some feedback if you have something. Mr. Simon Audiocott. Can you hear me? Simon?
Yes, please.
Yes. Can you please turn on your camera and give your short brief and your experience in Uganda healthcare?
Okay, thank you so much. I'm Simon Oriokot. I'm Assistant Nursing Officer based in Uganda and attached to one of the regional referral hospitals in the northwestern part. Thank you for having such a wonderful discussion. As the colleagues have rightly said, there are a lot of things. The country would say, is in a fair state, but I think there are a lot of things that are missing.
Yeah.
Maybe because we're still trying to develop and trying to benchmark with a lot of policies, trying to implement them. But one of the greatest challenges that I've also discovered is the issue of the human resource attached to the healthcare system based on the population that we are having. If you try to find out in the statistics, you find that the ratio of patients to the health worker is very great. And that one compromises the quality of services offered. You find, for instance, where I am, the ratio, actually the percentage of staff coverage in the hospital is at nearly 10%. And now this is a place, a regional referral hospital, where currently we have 2 specialists. So, and there are a lot of people, centers that refer. So instead of working on the cases that might have been referred, we also sometimes refer to other facilities, which are maybe slightly better. So that one cuts across. The issue of human resource gap is the key issue that I feel is bringing down the strengths of the health systems in Uganda. The EMR, as you had said, you are asking about, we're trying to practice it here, actually not practicing. The training was hard, but first of all, people were in a local setting where computer use and those electronic knowledge is still a challenge. A lot of people have those attitudes, but paperwork is still working. As he had said, piloting is going on, but there is no, I think it will take some good years for EMR to catch up well in Uganda. Thank you.
So thank you so much, Simon, for your very nice feedback. So I have most probably Dr. Francis Tom. So Tom, can you hear me? Am I audible to you? Dr. Francis?
Yes, you're audible.
Oh, can you please provide your feedback? After all of your feedback, then I again go to the Joseph and providing all of our information, how we can help you in Uganda. Yeah, Francis, can you please, what's happened in Uganda and what's your opinion, how we can improve your healthcare system on the global perspective?
Thank you so much. Yeah, thank you so much. I think we as Uganda, I think what I can say, the policies, basically the policies that are on ground already, they're actually very good policies. But the thing is executing what is on the paper, like putting them into work. That is actually where the challenge is. But if we are to see, the policies are not so much far with the other countries, not far from the World Organization recommendations. We have the resources, but now the challenge is how those resources are being used. Take for instance, yes, we can say that maybe we also have challenges with the human resource, but then how committed, how compassionate are those that are few on ground? Because one thing we have to know is for quality, yes, much as human resource might also be part of it, but individually, what have you so far done? We find that basically people underlook mostly talking to maybe the community. For instance, I'm working in a refugee settlement. You find that most times the curative measurements don't really carry a lot of weight. Mostly what you have to do is you change the mindset, the beliefs, and then what is on ground in the community. So you realize that much as we have the human resource, we have the resources at the facility. If you don't go down there and change the mindset of the people that you serve, it will be very hard for someone to catch up, and it will be very hard for you to get the results that you want. To talk about the electronic things, I think that is not so much a big problem because all we see is the attitude of people to get into, the changing world. So I think people have taken time, they are taking down time, they are not really bothered. The attitude is the one that brings everything down. However, also there are certain things that they will have to change. That is how things are being implemented. You find that we have a lot of guidelines, but if you are to follow those guidelines, if you are to find out that how many are going on ground to supervise the implementation of those things, you find that it's very hard for you to really come up with a real recommendation that this thing that we have put on ground, it's working. So commitment to implementation is one thing that is actually letting us down, because we are very good at generating ideas, we are very good at innovating, but then to follow up now those things that we have put in place, if they are working, that is where the challenge is. So I think that is basically what I can say. Thank you so much.
Yeah, thank you so much, Mr. Francis. I would like to go to Dr. Joseph again. Dr. Joseph, what you and me are wondering that there is a lot of but there is not people right. So, Dr. Joseph, what is your plan, or how can we work together or make something different that uh, we can collaborate and implementation plan? What are the strategies that we can follow so that healthcare system can be in a right places on our right way? Can you provide some strategies that we can follow and we can implement it the right thing? Any strategy?
Yeah, I didn't hear the initial part of your question, but I got the last
Okay, so I
part.
just make it very simple. I think there is some internet connection problem. So my question is, what are be the strategies so that we can be implemented the quality healthcare services in the Uganda?
Yeah, that is a good question. But I think to make it easy, that question can be answered in a very long way. But to make it easy and summarize, I think the first thing is to look at healthcare financing. Actually is considered the umbrella of all the healthcare pillars, which are currently recommended by WHO. I'm taking it as the umbrella because most of the problems we see and which people have been highlighting, people who are on ground in Uganda, relates to human resource problems, relates to supplies, relates to governance being weak. To the most part, it is due to inadequate funding, and you see that there is some form of parallel programs running, maybe from donors because they are giving money. So I believe that if we can solve that, it is not easy to finance healthcare, but one of the strategies which developing countries like Uganda are currently pushing forward is what is called the social insurance. It is already working in some countries, though it is at the early phase. I see Nigeria actually bringing in social insurance scheme to offset the cost of healthcare, because we are talking of a government which is depending on loans for financing a lot of its economic activities. And we are talking of donors being the major funders. And yet we need improvement, especially related to curative healthcare service. So one of the key areas which countries like Uganda can take is to see a way of introducing such schemes like social insurance to offset the cost. Another second high yield approach would be to adopt technology. Currently, there are various technological advancements which can improve access. The good thing the country is having increasing access to mobile phones, even in villages. There's access to electricity going to villages. So if such developmental areas can be aligned to health, I can see the country pivoting forward, improving access while using limited resources by leveraging the potentials of innovative services like the telemedicines which is coming. That one will reduce on the challenges of health, like need for referrals to long distances. And also it will improve on diagnostics. I can see a lot of the challenges the country faces related to diagnosis. And with technology, we can now do diagnostic, even we can do sequencing using very portable PCR machines. So all those things are innovative ideas which the country can take. There are so many areas which may not be easy to address in the short term, but the health of a country depends in great part due to the quality of the social services. Because health, to look at health, you have to look at the broader social determinants or the determinants of health, which, as I started my presentation, I said health, contribution of health related to direct provision of health care, which most people and governance look at, is actually not significant in overcoming the healthcare outcome or changing the overall health. I gave example of US, which invests a lot of money in expensive equipment, the most expensive, maybe all of them, name them, they are consumed in the US. And yet, if you are to rank US, it is actually even below some developing countries. If you are to look at definition of the health matrices, how they measure the health outcome, yet it is using a lot of resources. So the countries like Uganda should adopt such innovative ideas and approaches to see that it can leapfrog and use innovation. They can cause some initial maybe expenses, but the long-term dividends is more than the recurrent costs that the country actually incur during the provision of its healthcare service. So let us see, the country should invest in health innovation. I say it is a core, and it is, if countries like developing world use it, it can be applied in all the domain, in HR, in reducing the cost of the healthcare human resource. There are AI services which can interpret X-rays, and there are more which are coming. So it can leverage, it can help such developing countries which do not have capabilities, like to employ or to train specialized services. So such should be the vision of countries which lack I can say resources like Uganda.
Right.
Yes.
Dr. Joseph, you are doing really great, and your opinion is very fruitful from us. So we got another 2 or 3 people who are working on the ground, and we can, knowing about their experience, then we just ending up the session after talking with you. So here is Erico Angela Barbara. So, and can you hear me, Erico? Am I audible, Erico? Okay, so if Erico is not audible, so Yusuf, Mr. Yusuf Kanga, Mr. Yusuf Kanga, can you hear me? Well, so David has a question. Okay, so I just move forward to the Dr. David. So David, can you go for your questions? Yeah.
Just a brief supplement on what Joseph had said. In Uganda, in the health innovation space, we co-founded an organization providing telemedicine. On Joseph's supplement is that we are finding, as a country, we are really behind in digital innovations, because currently there are no proper policies and guidelines that the country has to look at. So we are finding like a lot of challenges to register a company. They are just implementing policies in innovation. That is another key challenge as a country that I think with your support, policies can be implemented. And because we are in some program, African Impact Initiative in Health Entrepreneurship, there is a lot of startup in the health innovation space, but you find that as a country, there are no policies, so you can't register those organizations. So others just do telemedicine without authorization. Hello?
Yeah, we can hear you, Dr. David. Yeah, you are audible.
Yes, that's just a spotlight on the innovation space as a country. There are no clear policies for digital health and innovations.
Well, I wanted to know about the David. So, how many medical colleges in your country, and how many medical graduates are passing in every year per year?
As for now, there are 10 medical colleges in the country, but only 8 are producing medical graduates. The other 3, their pioneer students are still in year 1, year 2, and the others. On average, we release over 2,000 interns. That includes nurses, doctors, pharmacists, and midwives. And
Well,
every
so
year,
can you tell me about how many doctors, let's say how many doctors are, passing in every year, right? So in Bangladesh, it's called MBBS, and some states it's called MD, right? So how
Yes.
many doctors are graduated per year in your country?
Yes, the current lot of interns, they have 1,000 doctors. The current cohort, which they are completing in September, the number keeps increasing year in, year out, because as the new medical school produces their first graduate, we expect the number in the next cohort to be higher than the current one. I completed my internship a year ago. We were 951 interns. The current cohort, they are over 1,000. So we expect the number to be higher in the next group.
Well, so can you tell me that another information, let's say the patient and doctor ratio, because you are serving in a community areas and you are serving the people. So for the patient doctor ratio, it's how much? For one physicians, how many patients can be able to see by a physician? Patient doctor ratio.
The doctor-patient ratio is really overwhelming, because currently where I work, we are 4 doctors in a general hospital. The hospital serves over 4 districts. And on average, the population in this district, I can say it's 200 to 2,500 to 2,000 to 250,000, 200,000 to 250. And we are the only 4 doctors in the region. All referrals from the peripheral facilities have to come to our facility. So we find that the patient workload is overwhelming to the doctors. Most times we work almost day and night for most of our shifts, and have a day off, because when you have longer days off, the workload is on your colleagues. So you'll be having fewer days off in order to catch up with the coverage.
Well, my another question to Dr. David, because Joseph, you are right now in Oxford University. It's the world's one of the most, the best universities, top class universities. But Dr. Joseph, what's happening? Have you any idea about the research that is happening in Uganda? Any kind of the medical research? Have you any idea about the medical research that is ongoing in the Uganda? Or research is focusing on the Uganda medical system? Dr. Joseph?
Yeah, thank you. The country has a lot of research capabilities, and as I said, at every point, there are a lot of interests globally, from the UK universities to the funders to the event companies which are interested in understanding the disease burdens and all those, and the health system strengthening. So I can say there are so many research initiatives which are either locally run or collaborative, which are running in the country. So the research capability in the country is actually very good. And actually, if you go to, there's a site called the clinicaltrial.gov. Actually, they rank countries based on the ongoing randomized clinical trials, that is in drugs and interventions which are running in each country. So you just find that Uganda is actively having so many studies running, though with still challenges, as I initially said.
Well, Dr. Joseph, because time is very short, I need to know about some of other questions also. So, what is the endemic disease right now in Uganda? Which disease is right now endemic in your country?
Yeah, endemic diseases, we have basically malaria, we have diarrheal diseases, which are caused by various bugs, and also we have those respiratory illnesses, pneumonia, caused by bacterial, viral pathogens. TB has been
yeah.
a great
So
challenge.
yeah, so I wanted to know from Eric, sorry, David, because you are practicing in Uganda. Can you please share with me? Let's say, Joseph, Dr. Joseph are talking about infectious or communicable or some diseases, but what's happened to the non-communicable diseases like hypertension or diabetes mellitus? Is there any kind of the non-communicable disease status during your regular intervention of the patient checking? Any hypertension or diabetes patient you have found?
Yes, the number is rising.
Yeah, David, continue. Dr. David, please continue. I think he has some connections problem, right? So
Yes,
we have please continue. Yeah.
Yes, so we have a poor screening program for non-communicable diseases. The few cases that we interface with are either those ones who are diagnosed before or the one who walk into the clinic with other condition and accidentally they are diagnosed. But the burden is very high in our communities because I remember we had one time an outreach to the community, just a one-day screening program. You're able to detect like 10 cases of diabetes and hypertension, leave along the cancers and the others. So the programs to screen and detect this patient and bring them to care is very, very poor. The other challenge is this is a long-term condition that requires long-term medication. So you find that this month, we have access to medicine, but next month, when the patient comes for review, we have no medicine. So if they can't afford, they will go for the full month without medication, however much we tell them to go and buy in the community pharmacy. Next time they come back with rising blood pressure, uncontrolled sugars. You're lucky, there is supplies you give. The care is not continuous as in chronic care.
Right. Right. And you know about uncontrolled hypertension, if patient are taking irregularly antihypertensive, that can problem is more and mortality rate has chances more, right? Because its consequences is very bad. So, Dr. David, what do you think about what's the risk factors beyond the non-communicable diseases in your area? Let's say for the hypertension and diabetes, we know about the infectious disease risk factor. There are a lot of overcrowding, sanitation problem, or something else. But for hypertension and diabetes, what do you think? Which risk factor is more prone to provide that kind of a condition?
Mostly it's diet and sedentary lifestyle because in the community where I practice from, most of the people are obese. Majority of the women, it's culture because I'm in Ankole sub-region. Their culture, they value women who are big. There is a cultural reach of gaining weight after you're newly married. So you find that they don't have the disease, but you really see they have the risk factors: obesity, sedentary lifestyle, and their diet is really not to the best.
Well, so we have another physician from Uganda, Dr. Mwaka Joshua. Dr. Joshua, can you hear me?
Yes, please, I can hear you.
Yeah, can you please turn on your camera so that we can see you? Yes. Well, Dr. Joshua,
Yes.
thank you so much. I think you are surgeon, right?
No, I'm a general practitioner
Okay,
working in
that's
a
fine. General
children's
practitioner.
surgical
Okay.
hospital.
So, Dr. Joshua, can you share me about which area you are right now in practicing and in a daily basis, which kind of the patient you are receive and which is the more prevalence on your area, which kind of the patient?
Basically, currently we are seeing children. This is a non-government organization established children's surgical hospital that is established by emergency NGO. So we offer free elective surgeries to children, basically from a wide region of Uganda and Eastern Central Africa. So that is basically it. Basically children, and we are dealing with surgical cases only. However, we see that definitely there are inadequacies in the Uganda's ministry, or I can say inadequacies in the healthcare system in Uganda and the region of Eastern Central Africa, because these cases are not detected early as they should be. They usually present late to the hospital, and they are associated with complications that come with late diagnosis and late operations. So maybe to supplement on the issues that have been discussed by previous presenters, Dr. Mwaka and Solo, I think main reasons why we have a lot of issues is one is the inadequate healthcare system funding. We have noted that Uganda basically allocates about only 7% of its national budget annually, maybe even less than that, to the healthcare system. And also we have increasing burden of disease. The issue of doctor-patient ratio is not really realistic in this country. I think we have enough healthcare workers, but the government does not employ them, does not deploy them for reasons of funding. Because we have so many healthcare workers, many are moving out of the country to seek for better pay in other countries, and many are really unemployed in the country. So the issue of poor doctor-patient ratio is not a real problem. We have enough medical schools that are training many healthcare workers, but they are not employed to tackle these
Right,
issues.
right. Thank
Yes.
you so much, Dr. Joshua, for your feedback. And we wanted to make a team in Uganda to ensuring about the more capacity building. And we would like to find out what are the challenges are ongoing in Uganda and what are the opportunities and how we can together work together globally and make the strengthening system that can be developed in African countries. So we have our another guest is available, Dr. Kirunda Ibrahim. Dr. Ibrahim, can you hear me? Dr. Ibrahim?
Yes,
Yeah,
colleagues, good
can you please
evening.
turn on your camera?
Yes, good evening, colleagues. Sorry
Good
for
evening.
joining in late, but I'm not very late.
Okay, Dr. Ibrahim, please turn on your camera so that we can see you. Yeah.
Oh, what has happened? My camera
Well,
was on.
thank you so much, Dr.
Okay.
Ibrahim, for your joining. We are almost at the ending of our session, but thank you so much for your time that you have joined right now. So, Dr. Ibrahim, that's I wanted to know from you that we are already discussing about the present conditions of Uganda and what are the opportunities, what are the challenges, and how we can overcome. So can you say something, so Dr. Ibrahim, how we can collaborate together and make a good team, and how can this team can be ensuring the good capacity buildings to the medical team, volunteers, and providing the estimated support to the healthcare system in Uganda? Have you any suggestions how this team can be collaborating together, Dr. Ibrahim?
Okay, thank you so much.
We can't
we
hear
have-
you. We can't see you. Can you please turn your camera from your yes, this is fine. Perfect. Yeah.
Yes, what I'm saying is that building on the previous discussions we had and having in mind the idea of what I was saying, that based on what we have just been discussing in the past few days, is a timely idea to have telemedicine started, and this collaboration will be very helpful in enabling the health workers, one, to seek technical assistance in time, but also to reach out to those who need care. And with some challenges of technicalities that might require the health worker to seek advice from above. And then given the other fact that the referral system is not all that so strong, and there are unnecessary delays, especially when it comes to maternal child health, where we are seeing quite a number of maternal deaths and children dying. There are currently, our Uganda Health Demographic Survey revealed to us that currently the maternal death is 189 per 100,000 live births. And so this collaboration needs to be expedited, and we need to quickly share this with the government to be able to tell them what we intend to do, but also the benefits of this collaboration. Thank you.
So thank you so much, Dr. Ibrahim. So I just go to Dr. Joseph. Can you provide your final opinion? Then we would like to conclude the session. And your final opinion should have to be, this is not an in, this is just beginning. This is our team that we want to work with Uganda people, help people, collaborating each other, and ultimately strengthening the healthcare system. So Dr. Joseph, can you provide your final feedback?
Yeah, my final feedback as a summary of my presentation, I've talked about majorly getting it started. Uganda has potentials, much as we have talked about so many limitations, but also there are potentials. The country, the economy is generally growing, and digital approaches like the one the team is starting will contribute enormously to the country's health, overcoming some of the challenges which we have seen and we have heard from the medical team who are actually on ground, related to access, related to the funding actually not being there. Sometimes we may think that the government maybe is hiding some money, but the priorities are so many. So we need such approaches where we invest in digital infrastructures that can help both the patients and the country in reducing the cost and also improving healthcare. So looking forward to expanding on the team, the Uganda team, people in the US, people in Bangladesh.
Yes.
We shall keep working together. Thank you.
Well, so thank you so much. And I just wanted to say that a lot of the Bangladeshi peoples are seeing this show. So can Dr. Joseph and Dr. Ibrahim say something to my country's people, my Bangladeshi people, say hi from Uganda, so that my peoples will be happy that from the African continent they will get some appreciations, right? So Dr. Joseph, can you say something for Bangladeshi people? Or everyone can say just one line. So from Dr. Joseph, let's start from my people.
Okay. My parting shot for Bangladesh people is that I will be in Dhaka and appreciate their country actually. The work they are doing is enormous. Actually, I admire the resilience that the health workers there go through. Actually, they have similar settings like us in Uganda in terms of some of the bureaucracies, but I appreciate how the team actually is very eager, as we see from Dr. Hossain, taking a lot of initiative, driving change, and that is what we need, actually. Thank you for your artwork.
Thank you
I
so
hope to
much.
meet
Thank
you
you
in
so much,
Dhaka.
Dr. Joseph. Yeah, thank you so much. See you in Bangladesh. Dr. Ibrahim, can you say something to my Bangladeshi people? Say hi to my people. Yeah.
Hello, everybody. Hi. It's a time difference that has caused me to come a bit late, and I knew it was supposed to be starting at 7. But I'm sorry. Next time I'll make sure I check with Hossain about the time so that we join early. But greetings to all the Bangladesh team members. It's a blessing to have Hossain connected to us, but also with a lot of hopes in terms of the issues that we are trying to come up to collaborate to develop in the country. And also greetings to all members who are providing care to the people who need care. Thank you so much.
Thank you so much, Dr. Ibrahim. Dr. Joshua, can you say something for my people?
Hello, greetings from Uganda. I'm so happy to have joined this session, and I send you greetings from this side. We are looking forward to further collaborative efforts together to see that we better our healthcare systems. Thank you.
Thank you so much. Dr. Simon, Mr. Simon. Yeah. Okay. So Dr. David, Soro David.
Hello. Greetings from Uganda. We look forward to further collaboration with the people of Bangladesh. Thank you.
Thank you so much. Dr. Felix.
Okay, thank you very much. My people in Bangladesh, Bangladesh is one of the countries that grew very fast in the history of development and has surpassed many countries. So we look forward to learning, actually, to have a shared learning with the people in Bangladesh, and perhaps also visit Bangladesh and see those mangrove forests and enjoy the terrain there. But
thank you
that's it.
so much.
Thank you.
Thank you so
guys.
much, Dr. Felix. Thank you. Mr. Francis Tom. Mr. Tom, maybe, yes. Mr. Evailin or Evailin NA. Evailin, can you say something?
So good evening, everyone. I cannot put myself on video. My internet is very bad. But I'm from Uganda, from the central region, and I've been following closely. It would be very nice to be collaborating with you.
Thank you so much, Evailin. Thank you so much. Thank you so much, everyone. So this is Dr. Hossain Al-Amin, and as we conclude today's discussion, it's evidence that Uganda healthcare system faces both challenges and opportunities. So as a Bangladeshi physicians, I wanted to collaborate with Uganda's people, and we can help together, we can connect together and collaborating together and searching the opportunities how we can collaborate. And by addressing the weakness and capitalizing on the strength and opportunities of Uganda people, we can work towards a more resilient and equitable healthcare system that serves all the Ugandans. I would like to extend my gratitude to our guest, Dr. Mwaka Joseph, Dr. Ibrahim Kirunda, and all of our physicians and guests, those who have joined and provided their feedback. Thank you so much from my side, from Kambaii Health side, and from Bangladesh side for sharing their valuable insight with us. Thank you to your listeners for turning on. Until next time, stay healthy, stay informed. Thank you so much for joining today's session. Have a nice day. Have a nice night. Goodbye.
Thank you. Bye-bye. Good night.